Please forgive me if I read more because I'm obviously a bit nervous, so it helps. And again, I'll have to apologise for just talking about what I know about, which is mainly serious mental illness from many points of view, as well as carers. The mental health services in crisis, how do I know? I compare my experience over 60 years with the experiences of my Stockport group members now. We've got over 80 families and supporters involved, nearly 100 by now. After I was born in 1950, my mum became mentally ill, and she never went out for many years. She was a recluse. When I was at uni in Exeter in the 70s, early 70s, I had a breakdown, still don't know what it is, and I had ECT, but the service was good enough and I recovered enough to become head of department in a school and work at the local college. Didn't let anybody know in those days, but that worked for me. Also, with work, I worked in a day centre, mental health day centre, and which was great because the psychiatrists, everybody mucked in together. I was from the college doing studies, and at that same time, ironically, my eldest son was diagnosed, well, it wasn't diagnosed, it was the usual mushroom treatment for about 2.5 years, but with schizophrenia. And we had in Tameside Making Space Care and Service User Group for 8 years. Then in 2004, my youngest son again took a bit less to diagnose. And so eventually we had the Stockport group. So I know the mental health service is in crisis. The people in charge of it with overall responsibility for strategy and duty of care both nationally and locally are mad. Evidence. The government is delusional. Cost improvement plan. How can you improve the service we are receiving in Stockport by clawing back funding of 16% and getting rid of over 13 full-time qualified workers in 2 years? The Stockport CCG is out of touch with reality. Knowing that the number of people in the general population needing mental health care is 23% and allocating 8.5% of the budget in a borough which has a high percentage of elderly with dementia is out of touch with reality. The commissioners in Stockport have delusions of grandeur and a perception disorder. Bringing in a model based on getting people out of service as soon as possible, when we all know that people with long-term serious conditions want and need continuity of care, and denying any changes to the policy on discharges when 330 extra service users were discharged this year is delusional. And I believe that the Commissioner for Adult Social Care, I think he's got the Marie Antoinette syndrome, because every time we tell them just how difficult it is for our carers, he talks about cake and whose share of the cake. Yeah, do you recognise it? Yes, yes. We're not talking about cake. We are talking about young adults, at 60 to 65 that we're in, whose lives are not getting better, and it doesn't need to be like this. Right. The government is delusional, thinking that they can help vulnerable, frightened people by taking away their services and assessments of need and their welfare benefits, and they will all get all the help they need from a loving community which it has its voluntary services decimated from withdrawal of funding, is delusional. The government is delusional by closing hospital beds and then taking away qualified mental health nurses, OTs, etc. in the community to help people become independent. We are back to old ladies, like me, caring for middle-aged offsprings in their bedrooms and worried what will happen to them when they get ill themselves or die. As we know, a lady in the northwest, not in Stockport, who was terrified of this because she had 2 sons with schizophrenia and she was worried sick if anything happened to her. And this was, when was it, July?
July.
Yeah. This is progress? I don't think so. The government in Stockport Adult Social Care is out of touch with reality. If they think they can improve population well-being, the population's well-being, by funding this, by taking away the money from people with serious mental illness. If you had a young adult son or daughter, and schizophrenia often begins around 16 years, who had an incurable but treatable life-changing illness, say a type of brain cancer, and because of a change in policy, most of the funding was redirected to prevention of smoking in schools and prevent lung cancer, and people couldn't get a bed in Christie's, and most of the Macmillan nurses were sacked, how would you feel? Devastated? Well, that's how we feel. People need treatment and resources according to their needs. Our young people should not inappropriately be grouped with old people like me with long-term conditions, which is what's happening now. The commissioners and Pennine care managers have cognitive impairment. Implementing policies which cause people whose conditions mean that they find it difficult to engage and need skilled people to help them engage should be discharged into the community to their family's care, and the reason given, they won't engage. Withdrawing care from people taking dangerous drugs which can cause diabetes, obesity, etc. Is not right. Withdrawing funding from people who cannot have a good quality of life because they can't smoke, they can't drink alcohol, the drugs make their sex life, lack of libido, they can't eat, they get obesity. What have they got left? Rock and roll. Most of the psychiatrists must have schizophrenia. Why? Because they fail to engage, and that is a symptom of schizophrenia. They're failing to engage with us to challenge the powers that be and stop this car crash, these tragedies. Some also have identity crises, as they tell us to phone the police if we need help and not to contact them. Because of this, the staff are becoming mentally ill with stress, anxiety, insomnia, loss of confidence to do their jobs properly. It is impossible because of the caseloads. And we carers, as well as having those symptoms, are becoming paranoid because we can't trust the people who are supposed to be planning and managing safe and effective care and treatment of our loved ones, but only think of financial planning. Some of the carers are almost suicidal themselves, and many have told me that they can't cope, and the only way they can go on is by physically or mentally running away and not caring anymore. Where does this all leave the people who have serious mental health conditions? Well, Richard Drake, one of the psychiatrists, said to us, he quoted from the Latin saying that they caused a devastation and called it peace. My quote is from King Lear: who the gods wish to destroy, let them first make mad. And if you want to be really tough, make them mad in Stockport.